Hey everybody, Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday. And today we're talking about how estrogen therapy could have an impact on your overall physiology and could make your hypothyroid symptoms seem worse and potentially result in you needing or you being prescribed more thyroid medication, especially T3 based medications. So this is a person who came to see me. She was seeing another practitioner. She had initially been optimized with thyroid medication at 60 milligrams of NP Thyroid. Her free T3 and reverse T3 were in the range that the practitioner thought was optimal and was on that dose of medication. But because there were some persistent signs and symptoms and her age, her doctor ran hormone testing, and hormone testing indicated that she had lower levels of estrogen than this practitioner thought were optimal. And so they decided they would start some estrogen replacement therapy. And initially she felt a little bit better, but within a short period of time, she started to feel a little bit more hypothyroid signs and symptoms coming back, and went back to see her practitioner and said, hey, I'm not feeling optimal anymore. I'm starting to feel hypothyroid signs and symptoms. Could the estradiol have caused that problem? And the practitioner, based on the patient, said, no, it couldn't be, but they ran another thyroid panel just to see what was going on. So when they ran the new thyroid panel, now her free T3, which had been optimal, was now low, and that did correspond with her increased hypothyroid signs and symptoms. So the practitioner said, look, your free T3 levels have dropped for some reason. What we're going to do is we're going to increase your NP Thyroid. So she went from 6 milligrams of NP Thyroid to 90 milligrams of NP Thyroid. And unfortunately, as she increased the dose, she started getting more anxiousness, more irritability, more anxiety, and she still had the hypothyroid signs and symptoms. Frustrated, she reached out to me to kind of see if I could evaluate her labs and give her a different take on what I thought might be going on. And so I explained to her that she's got some type of immune inflammatory process going on. And when she started the HRT, that probably resulted in less free hormone. And that's why she had more hypothyroid signs and symptoms. And then she said, well, why did I start to get more hyper and hypo when we increased the dose? So I had to explain that piece to her. But I thought it would be a good conversation for a Thyroid Thursday. So most people who have Hashimoto's, hypothyroidism, they have an immune inflammatory process going on. And what the literature tells us is that when we have an inflammatory process going on, the body makes more thyroid binding globulins and there's less free hormone available. Now, this is an adaptive response, not broken physiology. And so she's got Hashimoto's, she's still got an inflammatory condition despite optimizing estrogen and optimizing T4 and T3. This increased thyroid binding globulin, because of the inflammatory cascade, is going to decrease free thyroid hormone. So in a person who's got hypothyroidism, you can give T4, but if you have this inflammatory process going up, there's more binding globulins, so there may be lower levels of free T4, and when you have lower levels of free T4, then that's going to result in decreased conversion of T4 to T3 because less T4 is becoming free. The inflammatory process will also decrease the conversion of T4 to T3, which is often why, especially in integrative functional medicine, we're looking at the free T3 and saying, hey, this is way too low, we need to give you T3. I'm not a big advocate of giving T3 necessarily. I look at the low free T3 state as an indication that there's reduced conversion for a reason. And my job primarily is to figure out what that reason is for each individual person. So this is a person who is already in this state, low-grade inflammatory state, increased binding globulins, and they provided enough T3 to actually put that free T3 into an optimal range for that person, and she had felt better. But then she adds estrogen, okay? Now, when you increase the level of estrogen in circulation, that's going to result in an increase in what we call sex hormone binding globulins. So now there's more transport proteins so that they can carry the sex hormone around the body. But remember, this person had an inflammatory process going on, and they already have some elevation of thyroid binding globulin as part of that inflammatory process. But so when you add estradiol, that increases estrogen, that increases sex hormone binding globulin, that also increases thyroid hormone binding globulin. So the addition of the HRT, which may have been an appropriate strategy given a low estradiol level, the problem with that is it increases the total binding globulins for hormones, and that unfortunately resulted in less free T4, less free T3 in circulation, and the patient had increased hypothyroid signs and symptoms. So absolutely, the fact that she was already in an inflammatory state, already on thyroid medication, and now adding estrogen, you just have an increase in the binding globulins in the system, and there's less free hormone. So absolutely could happen. But then she got her doctor decided to increase the NP Thyroid, and she started experiencing hyper and hypo symptoms at the same time. How would that work into this whole situation? When the doctor increased her from 60 to 90 milligrams of NP Thyroid, because under inflammatory conditions, due to transport mechanisms, due to cell receptor type, the brain gets saturated a little bit faster than the peripheral tissues. So the increased NP Thyroid with the increased levels of T4 and T3 than she was taking before, that probably quickly saturated the hypothalamus and the pituitary. That resulted in, when you saturate that hypothalamus with more T4, that saturates the receptors, it drops TRH, and when you drop TRH, then there's a drop in TSH, and when you also saturate those receptors in the hypothalamus, you activate the sympathetic nervous system, which was probably already upregulated because of the inflammatory process. But when the TSH got suppressed, and the TSH was suppressed low enough, it was under 1, now what happens? Now you're losing the thyroid gland's contribution to both T4 and T3, which ultimately reduces the amount of T4 and T3 in the system. So now we're putting more thyroid hormone into the system because of the inflammatory state. The brain gets saturated much faster. It upregulates the sympathetic nervous system. That creates anxiousness, anxiety, and irritability. But because of the inflammation reducing T4 to T3 conversion, because of the increased binding globulins causing less free hormone, and with the suppression of TSH, there's a total drop in T4, T3, and free hormone. So yes, it was going to make the hyperthyroid symptoms worse and make the hypothyroid signs and symptoms worse at the same time. So this mechanism can easily happen. It's one of the reasons why when we're looking to do what some people call optimization therapy, you can't just run sex hormones and say estrogen's low, I'm going to give it, without taking into consideration, is there an inflammatory state? What's the sex hormone binding globulin levels already? Is this a person on thyroid medication? What's their T3 uptake already? What's their conversion ratio look like already? Because if you don't look at any of those things and you just flood estrogen into the system, it can absolutely have an impact on thyroid physiology, without a doubt, okay? So in some people, they take some estradiol and they feel fantastic. That's awesome. They probably don't have the same cell stress mechanisms going on. They don't have the inflammatory processes going on. But if you're somebody who has hypothyroidism, you have Hashimoto's, you have thyroiditis, you have inflammation going on, your binding globulins are upregulated already, your free hormones already downregulated, you may be manipulating those free hormones into range with T4 or T3, NP Thyroid or ARMOR medications, but now you add another variable like increased estrogen into the system, and it could throw everything off and cause both hyper and hypothyroid signs and symptoms. If this is helpful, I think that's great. If you have some questions about your thyroid physiology and want some answers that you're not getting elsewhere, DM me Discovery and my team will send you a link to schedule a complimentary discovery call. We can see what we can do to help you recover your thyroid physiology.